Hello everyone, my name is Pegah Karimi. I'm a PhD student from Indiana University. Today I will give a presentation for our paper with the title of Designing Conversational Assistants to Support Older Adults' Personal Health Record Access. Recently, with advances in artificial intelligence and speech recognition, there has been an emerging interest in conversational assistants such as voice assistants and chatbots that support older adults' independence. One emerging area of interest is how conversational assistants can support older adults with health and wellness. However, there are still gaps in understanding of how these systems can best support older adults' healthcare needs at home. Sources that older adults often use to manage healthcare needs include communication technologies, informal caregivers, personal notes, and doctor's notes. Communication technologies such as phone calls or emails allow users to connect to healthcare providers, but this method can take more time because doctors may not be available to address a concern immediately. Personal notes can include information such as medication or treatment plans. However, it can be challenging to organize notes from multiple doctors. Older adults might also rely on family caregivers, but family caregivers might not always be available. To access notes provided by the doctor, older adults can use electronic health records, paper leaflets, and more recently, AI-assisted tools. While EHRs provide access to doctors' notes, they can be difficult to navigate and have limited support for older patients with low health literacy. Paper leaflets similar to personal notes can be challenging when patients have to organize notes from multiple doctors. Recently, AI-assisted tools have been introduced that can generate notes from patient-physician conversation to document patient data for the doctor. However, there are still open questions of the value of providing similar access to patients through their personal health records. To overcome usability issues associated with navigating online portals, conversational assistants have gained attraction in health conversation. CAs are a class of technologies such as chatbots or voice-based systems that can engage users in dialogue. CAs have been explored to support adherence to treatments for different user populations. They also have been used as an efficient way to navigate online portals by doctors and patients for specific tasks. In our work, we investigate older adults' perception of the CA for navigating patient information included in doctor's notes available in an EHR system. To help older adults navigate their personal health information, we developed a prototype called Miha, Multimodal Intelligent Health Assistant. Miha has three main design principles. First, it provides answer to the user's question using valid sources such as a doctor note. Second, Miha provides transparency by allowing users to see the text used to answer the question. Third, it provides answer for specific questions about an illness using a trusted consumer health source including Medline Plus and WebMD. After the user poses a question to Miha, Miha returns a response and additionally asks the user if they would like to see how the response was derived using the doctor's note with the highlighted portion of the text used to generate the response. If the user wants to see the entire note, Miha provides a preview of the file that includes the entire note. To help users with medical terminologies, the system asks the user if they want additional information. If the user selects yes, the system provides the user with a summary of the medication generated from a valid source. The AI model we use to provide an answer to the user question is called Text-to-Text Transfer Transformer Model T5. T5 is a large transformer model that is pre-trained on the large colossal clean crawl corpus. The model takes the doctor's note and the user's question and returns an answer based on the note. To test the effectiveness of the AI model, we used a public benchmark called medical transcription that contains 5,000 anonymized doctor's note samples associated with different medical specialties. The results show that the model is able to handle various types of questions, such as conditional or yes and no questions. We then conducted a user study with older adults to assess users' perception of CAs for health-related questions and the perceived usefulness of Miha and user acceptance of the tool for health information tasks. We first introduced the study and its purpose to the user. We then asked a set of demographic questions followed by a training session. Then we asked users to start the first task associated with the first scenario. In general, we defined 4 different scenarios in which users pose questions to Miha about a recent doctor's visit. An example is asking the type of medication their doctor prescribed for type 1 diabetes. Each scenario has 4 tasks. The first task requires users to type an open-ended question. For the first task in each scenario, we employed a Wizard of Oz method such that the wizard passed the question into the AI model and then returned the result in the chatbot. For this task, we wanted to understand how a user might naturally ask questions and interact with Miha and to test the relevance of the model's response without researcher influence. In the second task, users had to select a pre-selected question. This task focused on further exploring participants' perception of model responses, but also different ways of interacting with Miha beyond typing. The third task gave users the option to select the return response from Miha and view the response in the transcript. The focus of this task was to examine user perceptions about the explainability feature. Finally, the fourth task asked users to select a follow-up question to test beliefs about the inclusion of verified consumer-based medical text for supporting understandability. We changed the order of the 4 scenarios to account for any ordering effect. We then asked users interview questions. The total length of the study took approximately 1 hour. We provided $20 gift card as a compensation at the end of the study. Overall, we recruited 10 older adults of age 16 and above. Most participants mentioned they manage chronic illnesses. Half of the participants said they encountered difficulties navigating online portals. 1 participant had no usage, and 4 participants mentioned that they found it moderately or somewhat easy to navigate online portals. We then analyzed the post-task data using descriptive statistics and performed thematic analysis on the answers to interview questions. We collected the open-ended questions submitted to our prototype and examined how participants might engage conversationally with the system to find answers to a question. Our findings show that 78% of the questions posed to Miha were interrogative, whereas 22% were imperative. Interrogative questions ask the system to do something, such as "What is the medication the doctor gave me?" whereas imperative questions tell the system to do something. An example is "Plan of treatment for aches and pains." In addition, majority of questions were basic questions that did not include any additional information to clarify the intent, and 33% of questions were detailed questions that included additional information such as the name of the illness. An example is, "What medications will I need to manage my diabetes?" We also asked users to provide feedback on the answers to the question that the T5 model returned. While most participants felt the system returned relevant responses, they were more positive about close-ended responses compared to open-ended responses. We believe this difference was due to the sensitivity of the T5 model to question phrasing, as well as user perception of responses. After performing thematic analysis, one of the themes that emerged was the initial thoughts about Miha. Participants believed that Miha answered medical questions and remind patients about medical instructions provided during visits. For instance, one participant commented, "If you forgot to ask something during doctor's visit, you can use the system to find out and refresh your memory." This implies that the user's mental models of the system match our conceptual model. Another theme that emerged was envision uses of Miha. Participants described scenarios that Miha could be useful. This includes verifying answers to medical questions, managing information from multiple doctors, organizing personal notes, and reducing health anxiety. For example, one participant said, "When you are able to go home and actually look at this in the privacy of your own home, it would help you because you could be able to look at it and process it a little bit easier." Another participant said, "I see the same doctor every 6 months, so it also gives a reference as to what we talked about last time and how has things gone with my health." Another theme that emerged was Miha's comparison to online patient portal experiences. Participants mentioned that Miha could improve their ability to find information faster when compared to online portals. For example, one participant said, "My current portal, they do not have doctor's notes. You can see your test results, but the doctor may or may not put his notes in the body of an answer." Another participant commented, "One of the most useful advantages of using Miha system is saving time. Because I can see the right answer to my question as soon as possible, whereas with online portals I have to go over all the notes to find my answer." The fourth theme that emerged from our study was users' perception of Miha's responses. Participants said knowing that the responses were coming from a valid source or were aligned with their own knowledge increased their confidence in the information provided by Miha. For example, one participant said, "In the beginning, for some questions, I didn't receive an accurate answer, but after reviewing doctor's notes, I felt the answer was relevant." Another participant said, "I take diabetes medication, I take hypertension medication, but I knew that Lipitor was cholesterol medication." The last theme that emerged from our analysis was improving Miha. Participants provided suggestions on how Miha could better serve their needs. This includes simplifying interactions with medical terms, supporting better conversational interactions, and integrating new design features. For instance, one participant said, "Changing the terminology for the responses, making them simpler, reader-friendly. Because if I'm not a doctor or I don't know anything about the medication, I need the medication information to be simplified." Another participant said, "That sounds excellent using voice, especially for older folks that have problems with typing or with clicking buttons or whatever. It's a lot easier to just talk to text." Participants also pointed to some interface design features. This includes adding calendar, making Miha more personable, and include an option to chat with the doctor directly. Our findings suggest that older adults perceive a conversational assistant such as Miha that supports navigating and improving interaction with health information as useful. In addition, connecting Miha to a verified source could reduce some of the challenges for older adults who want to access their health information. Participants also appreciated the feature of Miha that was connected to a verified source. Our results suggest that tools like Miha could help older adults to become more knowledgeable and involved in their health. One of the future work would be to explore explaining features beyond showing the source. While participants found the explainability feature useful, they also mentioned the need to balance between providing information and assisting understanding, which suggests a need to further explore explainability methods that could be useful for decision making. We also have to explore how we can increase the likelihood that Miha's responses match users' intent, as well as adding personalization component to support better reasoning. For example, since we know that the AI model we used was sensitive to question wording, we could consider post-processing steps to aid query generation, but more work is also needed to detect users' intentions. Participants also tended to assume that Miha already had information about the user's health history, so including personalization feature might also be useful. Finally, we have to include other features in Miha, such as summarizing and simplifying medical texts. Participants mentioned it was not enough to simply provide an answer, and therefore they suggested including more features to aid their understanding of medical content. Therefore, in the future, to aid understanding, we will need to look beyond navigation and access issues to explore ways to better help older adults engage with medical content. Thank you.